Up next, I would like to call upon Dr. Munisekhar Reddy to share a presentation on an audit of general surgery publications by Indian authors. Please, sir.
Good evening, dear colleagues. I am Dr. Munisekhar Reddy from Bangalore. Today I am here to share our award-won paper, Audit of General Surgery Publications by Indian authors. We all know India have nearly 1/5 of the world population with 12 lakh allopathy professionals. With 75,000 practicing surgeons, the clinical workload contribution by Indian surgeons should be substantial proportion to global load. With this, we were curious to see how much proportion we have in terms of scientific publications to the global surgical literature. It was internet-based search on reputed index journals. We included the publications by Indian origin surgeons from the Indian institutions, considering editorials, review articles, meta-analysis, and randomized clinical trials. So, to say we have excluded case report series, surgical images, and publications by Indian origin surgeons outside from the Indian institutions. These are the most frequently reviewed journals by our general surgery colleagues. So, we included the 8 surgical journals in our study. The value mentioned within the bracket showed impact factor. As all we know, impact factor is defined as a number of publications published in a specific journal against number of articles have been cited over a period of time. It is calculated by an international body. We can see in this slide, over a 6 years period of time, in JAMA surgery, we don't have single publication, and in Annals of Surgery, we have only one publication out of 1678 publication. In British Journal of Surgery and American Journal of Surgery also, we have only one publication. In Canadian Journal of Surgery, we don't have any publications. In the International Journal of Surgery, we have 2.2% publications. In the World Journal of Surgery, we have only 1.2% publication. So, with this, the inference is very clear. We publish very little. So, the situation is even more disappointing when we look at the general aspects of the publications. 57% of our medical institutions do not have single publications against their credit. So, the discussion should be centered on why we are publishing very little, why it is important to publish, how can we improve this area of publication. Why we are publishing very little? There are certain factors. When we analyze our education system, it is a rote learning rather than thinking. Because of strict hierarchy, we discourage dialogue from our surgical junior colleagues, and we curb innovation with lack of documentation. And of course, there is no incentives which is required for a decent standard of living. As all of this, there is absence of publication culture in our Indian culture. We did a survey among our surgical colleagues to find out the causes for lesser publications. They mention the list like that: difficult to get follow-up of the patients, and we don't have enough time to write, we don't have motivation, and there is no training how to write a scientific paper. When we look at the review of literature, Das et al. Mentioned the more or less similar reasons for the lesser publications from the Indian authors. Why it is important to publish? Now we are living in the era of evidence-based medicine, where our day-to-day clinical practice decision based on the evidence-based medicine. So, if we don't publish, we cannot create basis for our daily day-to-day practice. So, the reasons among our surgical colleagues to say the importance of publications, the list is very big as mentioned in the slide. And when you look at the review of literature, Neeraj Modi, President of Pediatric Association by Royal Surgeon, mentions the importance of publication by saying, without inquiring minds, medicine will stand still. Robust research tools required to evaluate one's own practice. So, at least to evaluate our own practice, we require the basic skills of research. A beautiful article by Shane looked at various facts affect the publication includes egoistic motives and altruistic motives. These are the pathways suggested by our surgical colleagues to improve the publications. When we look at the review of literature, these are the solutions they offer. We must inculcate the culture of inquiry. That means we should encourage our junior colleagues to submit their view of thoughts if they have enough data support, and we encourage our surgical colleagues to publish more data by giving incentives in the form of more operating charges or offering fellowships. We should make the publication as a part of career growth, which is already started by MCI. We can start the publications initially considering open access publication. Start publish with simple audit and prospective studies. Complex articles can come later. With this, we would like to conclude. The time to start publishing is now. Thank you very much for patiently listening. Our mentors, Dr. Munisekhar Reddy and Dr. Lakshman from Bangalore. we would be very much thankful to them. Thank you very much. Any comments? I'm well. Yeah, Monica. Thank you, madam.
We are facing a lot of problem because NMC,
Yes.
as per the NMC, only 2 publications are required to become an associate professor. To become professor, 4 publications are required. But besides that, I am talking about surgeons because you were talking about surgeons. With all the hectic activity, that is IPD, OPD, and then the OT, the reason that was given for less number of applications was that. So at DY Patil, what we did is we have established a directorate of research with a lot of eminent people. And then number 2, we are having 2 script writers because they are not finding time, but the data is available.
Okay.
And number 3, all the residents who are giving MS exam, general surgery I am talking about, it has been made compulsory that they have to publish before they submit their dissertation and appear for their PG exam. These are the efforts that we have taken because since you are talking about Indian surgeons, I thought yes, I agree, but we are making an effort. I think institute is making an effort to see that research is, I always say that research and teaching learning, they go hand in hand. We cannot segregate both of them.
Yes.
Similarly, practice. Those who are practicing, they have to practice. They have to see that, as I was telling earlier also, patient care is very important, but research also is an integral part of it. So we have to find ways how best we can improve the research. Thank you very much. I thank the organizers for giving me this opportunity.
Thank you very much, madam.
I'd like to call upon Dr. K. Chandrasekhar to present his article based on synthesis, optical structure, and radiation transmission properties. Please, sir.
Good evening, everyone. Actually, in the mail they have mentioned only 4 minutes for the presentation. So that's why I didn't prepare the slides much, but I explained the thing exactly, what are the applications of my research, what exactly I'm doing. Okay, so actually my research is on glassy materials. So I think everyone around us regularly watching the glasses. Those glasses are prepared generally, most of the glasses prepared using the silica. But in the research, silica generally used in very less in number. Majority of the glasses in the research field prepared using the boric acid. Okay, actually this is Chandrasekhar from Usmania University. Actually there are 2 more associations, Oxford and CT. I have mentioned only 2 things. Please forgive me. In the mail they didn't mention anything. Okay, please next slide. Yeah, this is my research publication which we got the award, and in this you can see that the glasses name. So glasses initially we prepared with using boric acid. In my research we have used lead and borate. Whenever you listen, especially the researcher who know about the lead is a toxic element. You may get a doubt that it is a toxic element, why did you use that? But you know, even there are some drawbacks in the lead oxide. Even it is a toxic element, there are many applications in the field of optical materials. Optical material means actually the materials with lead, glasses, especially glasses, have got high refractive index. If we have high refractive index, we can use them in communication device, because I think in intermediate everyone have studied about the total internal reflection. That's the basic thing. Everyone, even biological student and mathematician, everyone will study about that refractive index, because if the material is having high refractive index, then that will be used in communication devices. You know what is the importance of communication device in this present life. But my work is not related to communication devices. It is related to the radiation shielding material. because radiation, I think you know the drawbacks of radiations in the present scenario, but even though there are drawbacks in the radiation, still we are using the mobile phones, everything. So everyone using mobile phones, everyone using, keeping the mobile phones in the upper packet only. Everyone knows even that. But we are using that because the importance of the mobile phone is become like that. So here the intention of this work is to control the radiation using the glassy material. Why glassy material? Actually, those who know the NFC, nuclear fuel complex, and BRC member, actually our sir is here, so I was interacting with him in the starting. Those people will know that the radiation can be controlled by a material which has high density material, high denser material. High density means, I think you know the definition of the density, but here I'll just explain you here. I don't take much time. Lead is having high molecular weight. So when you add high molecular weight chemical to the boric acid, we get more density. And bismuth oxide is also. Bismuth oxide is also having high molecular weight. If you add bismuth oxide and lead oxide to the borate, we got high refractive index. Comparatively, this is the relative measurement. Relatively, we got high refractive index for these glasses. So that's why we have sent these materials to one of our collaborator who is in Russia. That is the last person. He is Professor M.S. Alburahi. Actually, he was looking at my research of PhD. My PhD research also is on lead borate glass only. So he was looking at the materials with high density. After looking at the materials with high density, he approached using a research gate. I think everyone knows the research gate. And using the research gate, he approached, please send your samples to me. I can do the radiation shielding materials. So this is the first research we have collaborated with Professor M.S. Alburahi, and then we have continued this work. But lead is a toxic element, so we have to go for alternate elements. So after that, we have got cadmium oxide is the alternate element, because and in the 10th class, I think everyone studied the nuclear reactor. In nuclear reactor, the control rods are used as a so cadmium is used as a control rod. So whenever a nuclear fission is taking place, if you want to control the nuclear reaction, we will use the cadmium rods in that. So that's why in the next research works we have used cadmium oxide and bismuth as additives for the borate glasses. We have done some other different composition of glasses to get the high efficient radiation shielding material. Please, can you just go to next. So this is one of, This is one of the research with the same author. In this lead fluoride we have taken just after the first publication, that is PBO, bismuth oxide and lead, and we have taken that next lead fluoride. Please next. We have taken next sodium tetraborate, calcium fluoride and tellurium oxide. Actually, this work is a costly work because tellurium oxide is having more price. Please next one. So this is strontium and aluminium. Here also we got good results. This is published in Ceramics International, which is having 4+ impact factor. Please next one. And this is another collaboration from Egypt and Saudi Arabia. So this is here we have got two different properties. One is radiation shielding, the other one is mechanical properties using ultrasonic velocity measurements. So in the next coming works we are doing with one from Turkey, Nigeria and Russia and Saudi Arabia and Egypt people, and about 10 research collaborators are there. We are working here, and so we are trying to get high density material to control the radiation shielding. Okay, thank you. Actually, I didn't prepare much slides because they mentioned only 4 minutes.